morning the state's grade when it comes to keeping kids off cigarettes and helping those who are trying to kick the habit. So how'd we do? The scores are mixed. And joining us this morning with more is Loretta Fuddy from the State Health Director and Dr. Reed Ikeda from the American Lung Association. Good morning to both of you. Thanks for coming in. And yeah, these are just straight off the press, these hot numbers on the grades. Yes. But Sepero, so we're doing sort of, I don't know, average, I guess. We're seeing A's in smoke-free air and our cigarette tax efforts. But we're still seeing grade C's in tobacco prevention and control program funding and cessation coverage. So, I don't know, positive numbers in some areas.
I think we're very pleased with the report. Hawaii has the third lowest smoking rates in the nation. Our adult rate is about 16.8%, and we've been very pleased with the progress that we've made with youth, working in the middle schools and high schools. Over the last 10 years, we've reduced their smoking rate by 68%. It's down to 8.7. It used to be up around 25%. So some really good progress there, but we certainly need to do more. And we're very pleased with the support from the legislature and the governor with the funding. As you know, we had some very tough economic times, so there was some diversion of the fund, but we preserved a good portion of the funding dedicated to the prevention of smoking. So we certainly can do more there, but we're very pleased with the progress we've made so far.
And as far as efforts to continue, where do you see that coming from? Because, again, funding is still a big issue when it comes to prevention.
I think we will continue with our funding level, and now that the economy is getting better, hopefully we'll have all the funds dedicated to this area continue to focus on smoking cessation. We do want to continue to work on our public education. We do have our Quit line, which has been highly successful. We've had about 25,000 people come through since 2005. We had about 300 calls a month that come in. So we need to do more there, continue the Quit line. We need to do one-on-one personal education. We need to continue to work at the schools. Because we find that there's about 1,400 youths that begin to smoke every day. And so we need to prevent that. So we need to do more also with one-on-one education as well as the public education and working on policies.
Right. Well, Dr. Ikeda, what do you say from a practitioner's point of view about the C grades for funding and coverage?
Yeah, so I think it's a mixed report. I think overall Hawaii can be somewhat proud of the results because even with the C grades, we ended up being ranked in the top 5 to 6 states in the country. So it's not just a Hawaii problem, it's a national, if not a global problem. From a practitioner standpoint, I'm a pulmonary critical care physician. I see the burden of tobacco-related illness on a regular basis, and those areas are areas for improvement, the 2 Cs. So one, I think funding tobacco prevention programs to keep our susceptible kids from beginning to smoke in the first place is going to be important. And also funding the cessation efforts is going to be important because 70% of smokers are interested in stopping and they just can't quite do it on their own because nicotine is so powerful and addictive. So I would like to see continued funding for these cessation programs.
And one area that needs to be corrected in the report, it said that for our public health fund, that we don't have cessation programs. We definitely do. It just didn't make it into the report. So we're hoping that grade will probably be increased to a B next year. So now that we know that for sure we offer smoking cessation through the Employee Union Trust Fund for all government employees.
All right. So we still have a ways to go.
Yes, we do.
Not too bad as far as the state.
Yes.
All right. Thank you, doctors, for coming in this morning. And to see this interview again, just head to the As Seen On section of our website, KITV.com. It's now 5:17. We'll be right back.